What I'm going to do is I'm going to squeeze her metatarsal heads together. This is the whole test, by the way. But you have to make darn sure that as you compress them together, they don't arch or move up or down. So what I would ideally do is I'd come in like this, and I'd squeeze together. Okay, but my butt's kind of in the way. So what I'm doing is I'm using a lumbrical grip, and I'm squeezing them together to prevent them from kind of moving up or down. So I'm literally trying to take the 5 of them straight together like this. And they would say, oh, that's my pain. It's usually between digits 2 and 3 or 3 and 4. Okay? I'd say, okay, that's a positive Morton sign. Then the other way I can do it is if you really want to pinpoint which digit it's between. Is it between digits 2 and 3 or 3 and 4, which are the most common places? I can use this little pincer grip like this, and I'm literally going to go between the metatarsal heads and pinch that neuroma. Does anybody here have a neuroma? You guys are so helpful. So I would say, okay, I'm taking this little pincer grip and I'm coming right in between the metatarsal heads, and I'll say, ooh, is that your pain? Okay. Is that your pain? I know, sorry. I apologize. Yes, I have a little bit of a thumbnail on that side. Okay, so that's literally the whole test right there. Dorsiflexion, eversion, plus great toe extension test. What's it called? Should be on the bottom of the page.
Dorsiflexion, eversion, parentheses, and great toe extension.
Okay, great. So now we are testing somebody who comes in and complains of medial foot pain, forefoot or onto the plantar aspect of their foot. And you're thinking that it's jogger's foot, otherwise AKA tarsal tunnel syndrome, AKA irritation of the medial plantar nerve, which is a branch off the tibial nerve, right? So if we're going to load the tibial nerve, what position do we put the foot in? Dorsiflexion and eversion. So the thing I'm going to add to it is the great toe extension, which biases the medial branch of the tibial nerve. Okay? So what you're going to do, my friend, is you are going to, as the test is written, you can just long sit. Okay? So what I'm going to do is I'm going to dorsiflex you and evert you. Watch, ready? And I count 1 Mississippi, 2 Mississippi to about 10 and see if that recreates my pain. Yes, that brings on my pain on the inside of my foot, and I feel it right down to the plantar aspect of my foot. It's very helpful for differential diagnosis between tarsal tunnel syndrome and plantar fasciitis. The other difference you will hear, people with tarsal tunnel syndrome have night pain. They have nocturnal pain, and it's that burning pain. So for some people, it's perhaps when they're really striding out, or, I mean, classic thing you see is the hurdler.